shot. Welcome to the office. I want to talk about your foot first, okay? And because the foot is very important, guys. And you had bunion surgery, a couple of them, on this side, right?
Not this one.
Yeah, you had a couple.
Yeah,
You had a couple,
yeah.
and you broke that one. And I want to talk about bunions and foot problems first, because it's very, very important. This is a foot model. This is the right foot model. Okay. Now, when we're looking at the foot, we have 26 bones in the foot.
Okay.
6 major misalignments that occur with an inversion sprain when we roll the ankle. And I'm going to explain those 6 misalignments and why it's important. The talus is, we call this the keystone bone to the foot, because it connects the leg to the foot. Yeah? Or it's part of the ankle joint, or the mortise joint is what they call it, the mortise joint. Now, 85, as it was taught to me, 85% of all foot conditions come from a misaligned talus. And I'm going to go through the mechanics. So the first thing misaligns with an inversion sprain is an AS talus, goes anterior superior, usually tilts on the medial side, can also tilt on the lateral, but usually medial. The next thing, so that's number 1. Number 2 is going to be the posterior fibula, where it goes back. It can also rotate out this way, okay? When we see an AS talus with a posterior fibula and the fibula is rotated out, we know there's also ligament damage. Third one is going to be the calcaneus. The calcaneus will go posterior and lateral, I'm referencing here. So we have talus, fibula, calcaneus. Next thing that can happen is what? This goes out, the cuboid rolls up, and the navicular rolls down. Follow my process. Cuboid will go superior, which will then affect the 4th and 5th metatarsal. Navicular bone, which is the arch, the medial arch, will drop down. That sets up hypermobility of the midfoot and the forefoot. The hypermobility can then cause a spreading and a drop of the 2nd cuneiform, which leads to plantar fasciitis. Okay? So, talus 1, fibula 2, calcaneus 3, cuboid 4, navicular 5, 2nd cuneiform 6. That's the order. Next, when we're looking at bunion, and we've had a lot of bunion cases in the past, the reality of bunions is this: they are fixable. But most people won't give us the time to fix it. It's a process. It took a while to get there. It takes a while. It can take up to a year of adjustments. Okay, I'm being very straightforward. Yes. And most people don't have that time. So it doesn't mean I adjust that person every single day for a year. No, but it takes up to that.
Right. Whether
it's bunions or hammer toes or things like that, guys. And it's important. So the easier solution for people is the surgery. Because that doesn't fix the problem though.
Right, no.
It does what? It deals with the symptom. And the way this happens is this. So you'll have a navicular, a metatarsal base off, right? So what happens with the bunion is this. Again, starting at the talus, follow kinetic chain. Now, with that, you can have a couple of things. You can have a drop navicular. You can have a superior 1st cuneiform. You can have a superior metatarsal base. And then you have gapping. So it does this. This goes out. And to compensate, the toe comes back in. Yes. So the fix of the bunion actually happens here, not here. It starts here. When it's time to get to the bunion, there's a few steps. There's pumping the capsule this way. There's setting it, and then there's something that is missed with most people, and these are called sesamoid bones. So I got a question for the audience today, okay? For the audience. I want you guys to look up what are called sesamoid bones, and they look like little sesame seeds. And I want you to tell me, or see if you guys can guess how many sesamoid bones in the foot, and how many sesamoid bones relate to the bunion, and what the most important misaligned sesamoid bone in the foot is. Leave a comment, guys. Okay. All right, so that's a whole nother process, okay? That all starts with talus. Now, as I said, 85% of all these foot issues come from a compensated foot due to a misaligned talus. That's why I work on the talus. Out of both feet, which one is worse for you?
I don't know.
Right side, left? Well, the left has the bunion surgery already.
Yeah.
So we're going to focus on the right then. Okay? We're going to do actually we'll do both. Let's prep. So we're doing talus, and I'm first starting with lotion. We want to work periarticular swelling, and we're feeling if there's any, we can't really feel the scar tissue as much here.
Oh.
Hi. You get mad at me, it's okay. Yalla. You tell me if it's too much, I will stop, okay? Look at me. Hi. She don't want to look at me, okay?
I don't want to be.
Okay, breathe.
I don't want to
Breathe,
prepare.
breathe. 5, 4, 3, 2, 1. Come on. 5, 4, 3. Jokes aside, okay? Let's get to work now. You gotta put a little, she got her poker face on now. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1.
Oh.
Alright guys, let's do AS talus, bilateral medial tilt. You far, come over. Come here.
Oh. Oh.
Wow. Us. Now I'll use the board to tune everything up, okay? You okay? Yeah. You can deal with it. AS talus, medial tilt, posterior fibula. Go to your left side. Posterior lateral calcaneus, other side please. Is chiropractic perfecta. Okay, now the fun part.
Can I have one napkin?
What's that?
One napkin.
You want one more napkin?
Yeah.
Why? Here. There you go. On your tummy. There we go. Alright.
Oh.
Kalas. And today you're having some knee pain.
Yeah.
Right?
Mm-hmm.
Okay. Anything else you want to add?
No.
Then let's get started. Raise your leg, please. I'm checking patellar tracking. There's a little bit of clicking right there. When I do a valgus stress, a little bit of clicking. Varus is a little bit more. We're going to then go into straight leg, valgus varus stress. He opens on the outside and the point tenderness is at the back there, right? You're making a funny face, dude. So we need to work on his posterior tibia. Come over here, boca abajo. So what we're going to do for this case is I'm going to work the capsular swelling. After the capsular swelling, I'm going to set the knee, and then I got to tape it. You ever seen your husband cry? You ever see your husband cry before?
Yeah.
You ever hear your husband scream before? You're going to hear it today, okay? Only at Dr. Rahim's office. Senor? Now I'm barely doing anything, dude. Come over here closer, you can see. I'm working the lateral capsule. I'm barely touching it. So I'm barely, but what I'm doing, he's got a bulging of the lateral capsule and disc. And if I don't apply pressure to set that capsule back in, there's a bulge, nothing's gonna hold. 5, 4, look at him. 3, 2, para, 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 papa. Relax there, come on. Come over here. Come closer. We're doing a PEX tibia. Gotcha. That's a home run, baby. Hold it. Now we're going to tape it in the LOC of the adjustment. This is just a hold. You can get a compression sleeve if you'd like over the weekend.
You made me cry.
I made you cry a little bit. He got a good movement in his belt. Is it different in the knee?
Yeah.
Jokes aside, a little different, right?
Mm-hmm. Perfect.
So, number one reason you're here.
I can't stand after. I can't be standing after an hour.
Okay.
Yeah, cause both of my knees start getting like really tired.
Both knees.
Yeah, and then they start like kind of like burning.
Bend the knee. And I'm checking the I'm checking the patellar tracking right now first. And what we're feeling for, 1, 2, 3 fingers on the medial aspect of the kneecap, checking for any clicking. Slight clicking when we're going out. Slight clicking right there. Not bad though. Not bad at all. Raise your right. Bend the knee. Fingers on the medial aspect of the kneecap, patella. Valgus stress, lateral to medial. Varus stress. Little clicking there.
Yeah.
Actually, more clicking there. Let's check this one more time, please. Raise the right leg. Bend the knee. Not too bad. There's definitely clicking on that left side, though. Now we're going to do valgus varus stress this way. What we're checking for is the opening of the joint space. Relax the knee. Let me bend it a little bit. So outside, inside. It actually opens up more on the outside right there. Tender right there.
Yeah.
It actually opens up on both sides. Now, bend the knee. Bring it right about there. More tender here when I push, more tender here.
On the left side.
On the outside,
Yeah.
it's a posterior tibia, dude. Raise your left leg. Straighten it out. Valgus varus stress. Opens up on the inside. He has an AIN femur on the left. He has a PEX tibia on the right. Straighten out both legs, please. I'm sure you got some ankle issues. Slide down. There you go. Bring both feet back. All the way back. Bring your toes back. This side goes back further. Relax the feet. More tender there.
Yeah.
More tender there.
Yeah.
Both?
On the right side.
Yeah. So he sprained his ankle also at some point. Okay. We have both knees. I'm not starting on both knees today. I will do the right ankle. And using a little bit of lotion to work out the swelling. Can you handle it?
Yeah.
I gotta go a little firm, okay? This is working the periarticular swelling. Feel that little nub right there?
Yeah.
This is the passive range of motion, intra-articular swelling. Good. So we're doing a talus, AS talus, medial tilt. Raise up. Relax it down. Raise up. One more time. Up. Dude, that thing is a board. Let's use the board. Thank you. Let's try the board. Raise the right leg, please. So Brian, we're going to go over your knee x-rays. Okay, and we had your knee x-rays done. This is an AP comparative knee x-ray. This is looking at you as if we're looking at you from the front. This is the right side. This is the left side. And in the analysis, what we're looking at, there's two lines that I still need to draw in. We're looking at the femur line and the tibial line should match up. What we can see on the right side is that the femur is rotated out right, and on this left side the femur is also rotated out right. However, remember we were doing valgus and varus stress, and on the x-ray the way we do it is this. I'm going to draw a couple of lines. So I had to draw the lines, and we had to draw the lines parallel to the joint. And when we're looking at this, we can now get a listing off the x-ray, and what's nice is that it actually matched up with what we found on you. We said when it opens up on the outside, it's usually a tibia issue. When it opens up on the inside, it's a femur issue. And so as on this left side, it's open on the inside and rotated out. So it's anterior on the internal side. This is an AIN femur. On this side, we have what? On this side, we have the tibia. And the tibia is what opens up. So we have a posterior tibia. Now, if we look at the joint space between the tib-fib, 9.5, 10.4, it's a smaller space here. And the reason it's a smaller space is this. We're looking here at the interosseous membrane. When it rotates back on the x-ray, it's going to project a smaller width, which is what we have here. So we have open on the outside, rotated back. That's a PEX tibia. That is the tibia pull move. AIN femur, that's the one in what I was showing you guys. We're doing it old school, Gonstead style, without the speeder board today. Okay, you ready, sir? And we're checking valgus varus stress. Yeah, we still need to work on that. Slide over this way. It's open on the outside there, valgus varus stress. That's pretty good, dude.
The left one's better?
Left one's actually better. We're gonna do a light bump on the left, light,
Okay.
but we definitely need to work on this one. Go on your stomach, please. I need to work with the lotion. After the adjustment, I'm gonna tape the tibia. I'm gonna tape it to hold the adjustment a little bit better, okay? So after the tibia adjustment, I'm gonna tape it in the line of correction to hold it a little bit better for you, sir.
Okay.
And the first thing we want to do right now is use the lotion. All right. Slide over towards me this way. Give me the leg here. And we're using a little bit of lotion. We need to work the lateral capsule. If we don't work the capsule, guys, then the adjustments don't really hold as well. They pop right back out. You doing okay there?
Yeah.
Traction, open up the joint. It's tender, I know. A little spicy. 5, 4, 3, 2, 1. A little more. 5, 4, 3, 2, 1. There you go. Center up. Okay. Relax the leg for me, please, sir. And it's a posterior PEX tibia. Nice and easy. Let that leg go for me, brother. Come on, dude. You can do better than that. Let go of the leg. Hold on to the table. PEX tibia. There you go. You're fighting, brother. Bend the knee. So I'm taping it in the line of correction to hold the adjustment better. Sit up for me, please, and let's do the AIN femur. Let's do the AIN femur. Raise the leg. And we're here. So we're setting the anterior femur. We're going to set it down this way. Traction the tibia, thenar contact right over the joint. And we're setting through. Let it go. A little more. There you go. Awesome. Okay, stand up and let's walk that off, please. Nice. So you have backwards pedaling, walking, swimming. You can also do some light biking. First month. First month. The other thing I want you to start doing, one-legged balances. You may want to get a disc like this. And for right now, stand on one leg. Stand on one leg. And you're gonna do 2 minutes, eyes open. Hold my hand with it right now. 2 minutes, eyes open, 2 minutes, eyes closed. Each side. Go to the other side. And what we're doing is we're working the proprioceptive mechanism in the ankles. Go on your back, please. Let's do the ankles. Cool. Slide up. Raise your right leg. Raise your left leg. Nice. You have any questions for me, Brian?
No questions right now.
Okay. So what I'm doing is I'm just breaking up some of the scar tissue and the fascia with vibration therapy. So we're using what's called a gua sha tool. I call it the bone cone. You ever seen me do this? Okay, and so the machine does the same thing. This one's a little bit of work. Okay, a little bit of lotion and working towards the heart. And what we're looking for is that gritty feel. You feel that?
Yeah.
So we're just breaking up that scar tissue, okay? You can do your whole body this way, Brian. 5, 4, 3, 2, 1. Walk 2 times back and forth. That should feel different.
I feel way lighter.
Walk on your toes, check this out.
It's a little bit sore from right now, but
Your whole right calf is red, by the way.
yeah.
And you're going to be sore with the gua sha. It's breaking up a lot of that scar tissue. You'll be red. Depending on how hard she goes, you're going to be a little bruised too.
It was just something right here on my toe, and I was step on it, felt like a little, like I had swollen or something.
Okay.
So I kind of brushed it off and I soaked it in ice. It went away.
You felt that your toe was swollen.
Underneath.
Under the big toe here?
Right up. Yeah, it's still there.
So you feel it swollen or painful?
Painful.
He's describing pain under the base of the third metatarsal right there on the bottom. You're actually right here. So this piece here,
Yeah.
that's right here.
Oh.
And you're feeling it shoot from here up to the back of the knee
Right here.
and into the butt.
And then it goes this way right here, like right now.
Okay,
I
so
feel
you're
something.
feeling it the
I'm
whole
feeling
way.
it.
You're feeling a pull, or you're feeling electricity, or you're feeling a pull. Okay.
A pull with a little sting.
Okay. The third digit is going to come off of the second cuneiform right there. So we don't need to touch the third metatarsal base. We need to go to the second cuneiform.
Okay.
2, 3. Mira. Aquí. Ooh, it's already moving. Wiggle your toes. Wiggle your toes. Da-da-da-da. Mira. 1, 2. Diferente.
Yes.
Watch this. Come on up. Take your time. Don't mess up my work. Look at that.
So, there's something on the toe.
Better?
I guess it'll go away as I walk. Keep walking.
I just repositioned a bone that's going to affect that. So what I did was this, dude. Check it out. You're complaining of the third toe right here, right?
Yes.
But I was finding this second cuneiform, this piece was up. So I set this back down. That affects the whole digit. So now it's going to find its happy place. I got to work on that ankle. Tender right there?
Yeah.
I got to put a little lotion there.
Okay.
Give him some love first. Give him a little love first, you know. And then kaboom.
Kaboom?
5, 4. Take it. Take it. You can deal with it.
A little bit.
5, 4, 3, 2. That's it, brother. That's it. I had to. If I don't break it up, nothing's gonna get fixed. Relax the foot. 5, 4, 3, 2, 1. All right, lady. Your turn now.
Oh.
Lift your head up, sir. Head down. Let's see, we got the chicharrón today.
Okay.
Ah, that's it. That was better.
Better.
That was better. I gotta use the board though. You okay there, Jose?
Yes, sir.
Raise the left leg. Relax the left leg. There you go. There you go.
Wow.
Turn to the left side, please. That's it. Bend this leg out of the way. Let's do the navicular. There you go. Sit up slowly, sir. And you can go ahead and put your sock on. Oh, I got your sock. Hold on here. Check it out. No.
Okay.
He's gonna do it himself.
I'm
Look.
used to.
Look.
I'm always putting this. sock-
Chicharrón did it himself this time, huh?
Very
That was already
nice.
remembered.
Yeah,
Here.
you got this.
You did it.
Yeah.
Sir.
Stand up and walk it off. Mejor?
Mm-hmm.
Yes.
One more time, please.
Compared to when I first came here, doctor.
Oh,
So
we're not going backwards.
you just document, please, as the days are going, how many times it's coming up, how long it's lasting,
You're good.
intensity and duration.
Okay.
Okay.
Intensity and duration.
That's most important for me, for
Okay.
him.
All right.
Raise your right leg. Raise your right leg. Sound is the board, not your foot breaking. You gotta see her face. Come over here. Come over here. Check it out. It's fun. Yalla. Yalla, walk it off. Enchi. Tell her Enchi.
Kindly.
Enchi.
What?
What'd
I
you
was
say?
saying, I feel my feet lighter
Your feet are lighter?
and I don't feel that turning anymore.
You don't feel what's turning anymore.
My feet.
Mm-hmm.
When I was sleeping, it always used to turn, especially while walking.
Okay. So, your homework is very simple. You get to walk and be a kid. You get to swim and be a kid. You get to hike and be a kid. You get to even go horseback riding if you want, okay? Just go be a kid. And we're going to use a little bit of lotion today. I got to break up some of the scar tissue in the ankle before I set it. You're ready for it now. And she said she likes spicy. So, now, let's see what we got. Okay. Now, when we look at both, the easiest way we're going to determine which one we're going to work on first is this. Bring your ankles or your toes back as far as you can. Both of them, please. All the way back. Which one doesn't go back as far? The right side. Okay? That's the one that's
Yeah.
a little spicy.
Yeah.
A little spicy. Okay. Now, this is kind of important, Jane.
Okay.
It is going to be a little spicy as much as you can handle.
Okay.
If you really can't, you tell me. This is an old ankle sprain.
It's true.
Yeah.
Over 10 years.
Yeah. You didn't tell me, did you?
I
Did you?
forgot.
Yeah.
You reminded me.
Yeah. It's kind of cool when that happens. So, when we're looking at the foot, right?
Uh-huh.
26, 28 bones in the foot. 6 major misalignments that occur with an ankle sprain. The major misalignment is at the ankle or the talus bone, this right here. 85% of all our foot problems start from a misaligned talus. I am right now working the periarticular swelling, the swelling outside the joint, and breaking up some of those adhesions with my fingers and lotion. The second part is going to be passive range of motion. This is doing two things. So I'm dorsiflexing and applying an A to P pressure with the web of my hand on the dome of the talus. I'm applying a little bit more pressure on the medial side. And what we're doing this for is we're doing this for the interarticular swelling between the joints. There you go. It's starting to loosen up. It may pop and crack a little bit, okay, as it's trying to find its happy place.
Okay. It pops multiple times throughout the day.
It does?
Yeah.
And the other thing it's doing is resetting the joint pressure. Okay. 5, 4, 3, 2, 1. Now let's get a little tissue. AS talus, medial tilt. Now, there's a lot of ways people do this talus, okay? A lot of people just do what's called long axis distraction, where they just pull it this way. And when you're doing long axis distraction along the, and everything is lined up along the foot, you're not going to hurt the patient or the person. It's not as specific. When we're doing it in this work, what we're doing is we want to get a very specific contact. It's not just a general contact. So we're on the medial aspect of the dome of the talus, second, third digits. Superimpose the others. Dorsiflex, turn in, and it's a scoop. Pull and scoop with the lats. I'm going to use the tissue right there. So, second and third, superimpose the fingers, dorsiflex, and push with the thumbs, evert or invert. We're going in. That got a little bit of your hip there. Slide down a little bit, please. Okay, a little bit more. You know what? I'm going to do something a little different. Let's do it with the board without, just so I have something to set it into. Okay. So I'm bringing it down, scoop. And the reason I'm using a little bit of the board here is so we don't have a lot of pull. A little more.
Oh.
Nice. Check it out. Walk it up. There's your 10-year-old ankle sprain, lady. No heels this week, please, okay?
Okay.
Just in case you do.
No, thanks.
Walk one more time. That thing was stuck. Let's go. Boca arriba. Now the fun part. AS talus. What's interesting in her case, a typical inversion sprain is an AS talus medial tilt. She has bilateral AS talus lateral tilt with bilateral posterior fibulas rolled out. So that tells me she's rolled both of her ankles in the past. So guys, when we're looking at the ankle, a couple of things. The way it was taught to me is always work this swelling and scar tissue, otherwise it takes a long time if it even holds, okay? And so we're gonna do the lotion and we're gonna start to break up a lot of that scar tissue in there before we set it, okay? Okay, let's start. So what we're doing, we're working the, can you slide down a little bit with me with the pillow? We're working what's called the periarticular swelling. You can even feel the swelling and the scar tissue in here. You can feel it. And we're just working what's called periarticular. This is on the outside of the joint, okay? And then we want to start to bring and equalize the joint pressure. Makes the adjustment easier. 5, 4, 3, 2, 4, 3, 2. Now, next part is passive range of motion. Let me do the work. Web contact, pushing A to P with dorsiflexion. Lateral side, medial side. Good. Now you can actually even see when we dorsiflex, it gets stuck right there. Good. I'm on the lateral talus. Oh, she's tough. She's gonna make me work, dude. Okay, don't let it go.
Okay.
Don't let it go. There. Bas. Now we do the board. Lateral side. Posterior fib, it's rolled, so we want to bring a little more A to P. There you go. Mira.
Better.
Now the other side.
Better.
You can even see the swelling is down. Pretty cool, huh? 5, 4, 3, 2, 1. Passive range of motion. 5, 4. Stop fighting, dude. Come on, let it go.
I think that I'm not fighting. Sorry.
4, 5.
Sorry.
Gotcha.
Ay, qué rico.
She like that.
You said God bless me, right? You said God bless me, right?
Yeah.
Okay. Check out the magic. Look at her feet. Check it out.
Okay, the swelling is way down.
Yeah. And it's the same in my knee. I have bolitas que siempre siento que me las trato
She
de
feels like a little ball that she's trying to take it, like every time she tries to massage
all
it,
the
but
time.
she
I
feels that.
feel
Face down. Left or right side more? Which one bothers you more?
right.
So I'm doing the right one. Oh, it's gonna be fun. Oh, she's gonna love me. All right, so same thing. She is asking me to work on the lateral meniscus and lateral capsule. So, madame, remember, you asked for it.
Okay.
Acuérdate que lo pediste.
Ajá.
Okay, so what we're doing, traction at the ankle, and that thing is like a marble. Come here, check it out. That's a marble. Feel
Yes.
it. Feel
Uh-huh.
it.
I feel it.
That's her daughter, by the way, okay? So it's not just some random person. 5, 4, 3. Yeah. 5, 4, 3, 2. Yo, Luis. Your wife is tough, dude. 4. Good tough. 2. Okay, hold on to the top.
Agárrate de adelante, ma.
Aquí. Relax there, please.
Suelta la pierna.
It's okay. Right on that tibia. Señora,
Ah.
hola.
Hola.
¿Qué pasta? Gotcha. Un poquito más. Gotcha. That's it. All right, now I need to put a tape there for you before you get up, okay? Keep the tape on. You can keep it on for at least 3 days. Okay, it's going to hold the adjustment better. Taping in the way we adjust it. It's a functional tape, Elasticon.
Okay.
That's it. You're all set there. Good stuff.
Yeah.
Check it out. If you really can't handle it, I'll slow down, but we need to get through this.
Oh no. If I don't say stop, you keep going. Oh,
So we're on the talus. Periarticular swelling, intra-articular swelling. Ooh, that's crunchy. Okay. Hi.
Hi.
How you doing? Ah,
Very
gotcha. All right. 5, 4, 3, 2. AS talus.
Ay.
AS talus.
Ay.
It's gonna be very different.
Ay.
It feels so light.
Mm.
Like I don't feel the need to do like push it like my legs.
Mm-hmm.
I feel like flying.
So, just looking at the ankles now, here's the interesting part. The right side got better. Little tender there?
Yeah.
Little tender there?
Yeah.
More tender on the left,
Yeah.
yes? Yeah, we're going to work on the left ankle. So it switched based on the adjustment. I thought I was going to adjust your right ankle before the adjustment. And when I did that last adjustment on the knee chest table, it fixed the pronation on your right and this one came up. So what I'm doing now is, you feel this is the scar tissue.
Yeah.
Okay?
Ouch, it hurt. Ow! Oh, that hurts.
If you really can't handle it, tell me, but I need to do this.
Okay.
Mama, you want to hold her hand?
Que se me quise ver la mano. That hurts a lot.
5, 4, 3, 2. Now, as much as she can handle, there's also 4, 3, 2, 1. Bus. Now, I need to do passive range of motion for the interarticular. You feel that?
Yeah. Oh my god.
Better. Let's go ahead and do the ankle adjustment now. Oh. Let it go down. This side.
¿El otro lado?
Bus. High five. Good job. Good job.
Thank you. Oh, that hurts.
Sorry, not sorry. I gotta do it. Come on up. Walk it off 2 more times. Tell us how that foot feels now.
Oh, it feels different. I don't know how to explain, but it feels more comfortable.
Smoother.
Yeah.
Like it's supposed to be.